Hello friends, in the last class we have learned about all the tests which can be done, and now there are some other tests like one more test which can be done is indirect immunofluorescent test. It is similar to normal immunofluorescent test which is done as in microbiology, but mostly we do Western blot test and ELISA test. These are the most common tests which are done for HIV. Now what is the strategy? Let us know about the non-specific tests also. In non-specific tests, this is the second. In non-specific tests, if you see, the first test is total and differential leukocyte count. In this total and differential leukocyte count, you will see leukopenia. There will be leukopenia in AIDS, where the lymphocytes, these will be less than 400 per millimeter cube. And second, there can be T lymphocyte. You can also do T lymphocyte subset assays. Okay. In this, normally CD4 is to CD8 cells ratio. This T cell ratio is around 2:1. But in AIDS it is around 0.5:1, so the ratio is reversed. Okay, in AIDS. And then third, platelet count can be done. In platelet count, you will see thrombocytopenia. And then fourth, you can do IgG and IgA levels. So these IgG and IgA levels will be raised. Then fifth, you can do skin tests for cell-mediated immunity. So the skin tests for cell-mediated immunity, this will decrease. Okay. Now, so these are the different tests which are done for HIV. Now the question is, how are you going to identify HIV? What are the strategies that are involved in identification of HIV? What are the strategies which are involved in the identification of HIV? First, strategy 1. Okay, in strategy 1, the serum is subjected to either 3 different types of tests. You can either subject the serum to, you will subject to screening tests. What are the screening tests? The screening subject the serum to screening tests, that is, it can be ELISA or rapid tests or simple tests. Okay, you'll subject the ELISA to these, and if it is positive, you'll take that HIV infected. Okay, if it is negative, then no HIV, that is HIV free. This is the strategy used. What is the use of this strategy 1? It is for donation safety. It is mainly used for screening blood, tissue, organ and tissues. Okay. So this is strategy 1, which is for donation safety. The second thing is strategy 2. In the strategy 2, it is divided into 2 types, strategy 2A and strategy 2B. So strategy 2A, okay, in strategy 2A, the serum, it is first done to first screening test. The first screening test can be either ELISA can be done, or you can do a rapid test or a simple test, anything can be done. This is negative. Okay. Then you will retest it with second test, retest it again with the same tests. Okay, ELISA, rapid test or simple tests. And now it is positive. But here the retest is based on other antigen, not the same antigen. That is different test principle or different antigen principle, different antigen. Okay, then it is positive. Then it is HIV infected. If it is negative, HIV free. Okay, what is the use of this strategy? The use of this strategy is for HIV surveillance. Okay, so this is strategy 2A, where we screen for 2 times. If it's negative, then we will screen for retest. If it is positive, we don't screen. It is HIV infected. Okay, so this is for strategy 2A. Now let us learn about the strategy 2B. Now in strategy 2B, what we do is, in strategy 2B, first in strategy 2B there is a serum. Then first you have done first screening. In the first screening of ELISA, rapid test and simple tests, you find that it is positive. Then again you subject it to the second screening. Okay, second screening, if you do ELISA, rapid test and screening test and this is negative, then you will again screen for third screening. Third screening is ELISA, the same test you will do again, and then you will find that it is equivocal. If it is negative third screening, then he is negative, reported to be negative. But if this is again shows equivocal, then such persons, they are tested after 2 to 4 weeks, they are retested again. Okay, but if this test is positive, that is what we do here. If the second screening test is also positive, then here's positive HIV. And you'll have to do a post-test counseling. So this is how you do. Okay, you'll have to retest again, and based on the results, you'll have to give whether it is positive or negative. Okay. Now, where is it used? Where is this strategy to be used? It is mainly used for an individual with symptoms of AIDS. It is used for individuals with symptoms of AIDS. Clinically, if the person has symptoms, then you can use this. So this is strategy 2B, where you will screen for 3 times. Only if 2 times are positive, then you'll say positive. If the second screening is negative, then you'll go to third screening. And in third screening, if it's equivocal, then you'll retest again. If it's negative, you'll say negative. If it's positive, you'll say positive. Okay. So this is the strategy 2B. The next strategy is strategy 3. Strategy 3. It is similar to 2A. Here you will send serum and you will give first screening. In the first screening, you will have to do ELISA or rapid or simple tests. And if it is positive, you will have to go to second screening. Okay, that is ELISA, rapid tests or simple test can be done. Now the testers think that the test is positive. Even if the second test is positive or negative, you will go to third screening. Even if it is negative, you will go to third screening. Okay, ELISA, rapid test and positive. If only and only this test is again positive, only then you will say that he has HIV positive. If the third specimen is negative, then we call it as equivocal, and we will again retest in 3 weeks. And even after 3 weeks it is found to be equivocal, then you will see after 3 tests, then you will say it is negative HIV. This strategy is used mainly for see, if it's negative, just think that if all the 3 are positive, then only HIV positive. That is important. All the 3 are negative, then HIV negative. Those are the 2 things which you have to remember. Along with that, you'll have to see this. The use is, it is for diagnosing HIV in asymptomatic individuals. Okay, so these are the different diagnostic test strategies which are available for diagnosis of HIV infection. So, and you'll also see in HIV negative, if you see that after even first and second test being positive, if this screening test is negative, then you'll have to equivocal and then you'll have to do this. Okay, this is for like this, whereas this is like this. Remember that. Okay, so this is about the strategy 3. So thank you guys for watching my lecture. If you have any doubts, comment it in the comment section. Thank you for watching my lecture.